What is rehab or rehabilitation? My name is Fred Begaris, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab podcast. Today's topic is on epidural lipomatosis. Epidural lipomatosis is the extra deposition of fatty tissue within the spinal canal. I usually describe the spinal canal as an elevator shaft, and it's lined with tissue, and there's a bunch of nerve roots that travel down the center of the shaft. Then they exit out through each level to go into your arm or your leg. That's kind of how I generally picture it. And what happens, the lining of the shaft, there is fatty tissue inside of the shaft, there's spinal fluid. Now, with epidural lipomatosis, there's extra deposition or there's extra fatty tissue inside of the elevator shaft. And what that does is it narrows the shaft, which is the description of spinal stenosis. When that happens, people can experience leg pain, numbness, tingling, weakness. Depending on the level of where the pinching is, it can actually affect the spinal cord as well, or the end of the spinal cord. So it is a kind of an interest of mine because it's an MRI is a very common study that we order to. Is there other reasons for stenosis, disc herniations, facet hypertrophy, ligamentum flavum thickening, anything that can narrow the canal? And I think from a surgeon standpoint, that's also what they're looking for is things to take out that are in the spinal canal or impinging a nerve root. I've noticed over the years, I've been practicing for about 10 years now, that epidural lipomatosis is kind of underreported. I go through the images myself looking for all the things, but I've noticed that epidural lipomatosis is not usually something listed. And I've wondered, is it just a locale thing? But I've practiced all over the country in the United States, and it's just not really reported, and that's kind of reflected in the literature as well. The reason why I bring it up is that I've wondered if it is an early sign of metabolic syndrome. Maybe not early, but if it is another sign of metabolic syndrome or forms of visceral obesity. Visceral obesity is a very high risk factor for a multitude of medical conditions. And I've definitely seen very young people, meaning like in their early to mid 20s, with back or leg pain. They get an MRI, everything kind of quote unquote looks normal according to the report. But when I review the images, I can see that there is clearly evidence of stenosis coming from the excess fatty tissue. So I think that that's an important thing to notice, because a lot of times surgeons are looking for things to decompress, but fatty tissue you really cannot remove just exclusively if there's a metabolic problem going on. In fact, I've seen some case reports where there is structural stenosis, and after they get a decompression or some sort of surgery, it almost like a reactionary worsening of the epidural lipomatosis to the point where it restenoses the area. So I wanted to discuss some potential treatment options or just things to consider. Obviously there is, weight loss and improving your overall lifestyle. That's actually been demonstrated in the literature that with significant weight loss through, diet changes, exercise, so on and so forth, that the fatty tissue inside of the canal can actually decrease and symptoms can improve. And I think a lot of times the general weight loss or the extra weight on the spine is what we think is causing a lot of the problems, and it is. But if epidural lipomatosis is actually part of the problem, are we not really considering that as a potential treatment goal when it comes to exercise? This also comes into the fact of surgery. Is that a surgeon, but do they remove fatty tissue as much as they can when they are doing some sort of decompression or foraminotomy. From a preventative standpoint, if I do see a young patient, or I guess any patient that has evidence of epidural lipomatosis with back and leg pain, but otherwise is healthy, is this someone I should be referring to see endocrinology sooner than later? I have talked with some endocrinologists over the years, and some primary care folks as well. And, I don't think anyone's really ever thought about it. And of course, let me know if people have been doing this kind of research and I'm just late to the party. But I do think that it is a potential intervention point, that if we see this radiographic finding, we should be doing something else in addition to treating the actual symptoms. But again, we go back to the other primary issue, is that it's generally underreported. So I'm not sure from a radiology standpoint, maybe I should be asking specifically for them to report on epidural lipomatosis. Typically, I look, or I write down on the referral, rule out stenosis. But again, just something else to consider. Another treatment option that's obviously in the media is kind of helping a lot of people with a lot of weight loss, is the use of Ozempic. Has been shown to improve visceral fat, in addition to weight loss, and has a bunch of health benefits. It is still a relatively new medication, so I'm sure we are prospectively monitoring potential long-term side effects. Maybe from a research standpoint, I'm not sure. I kind of did a search over the past couple of weeks. I haven't seen epidural lipomatosis as a factor that's being monitored when it comes to Ozempic treatment. Anyhow, I'm just putting this out there. I think that obviously, back pain and stenosis is kind of a global problem. Maybe epidural lipomatosis is a potential intervention point, but I just wanted to throw this out there onto the internet to see if other people are thinking the same thing. Maybe if there is research going on that I don't know about, please make sure to contact me or throw something in the comments. Thank you for listening to the Talking Rehab podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.